Lymphatic System. Mrs. Samruddha Siddesh Kale, Nursing Professional. Important terms. Lymph, a fluid that contains white blood cells that defend against germs. Lymph vessels, vessels that carry lymph throughout your body. They are different from blood vessels. Lymph nodes, glands found throughout the lymph vessels. Along with your spleen, these nodes are where white blood cells fight infection. Functions. Protects body against foreign material. Assists in circulation of body fluids between cells and bloodstream. Transports dietary fats. Lymphatic system consists of lymph, network of vessels, lymph nodes and nodules, tonsils, spleen, thymus gland, bone marrow. Lymph. Lymph is equal to clear fluid, derived from tissue fluid. Contains more white blood cells than plasma. Enters node through afferent lymphatic vessels. Flows through node in one direction. Flows through sinuses in lymph node cortex and then into the medulla. Exits the lymph node through afferent lymphatic vessels must be lymph capillaries, microscopic closed-ended vessels. One located next to blood capillaries in tissue spaces. Two larger diameter than blood capillaries. Three are very permeable and collect tissue fluid and proteins. Four lymph capillaries merge to form larger lymph vessels. Lymph vessels. 1. Resemble veins but have thinner walls and more valves. 2. Ends of endothelial cells overlap, act as one-way valves allowing interstitial fluid to flow in but not out. 3. Attached to surrounding tissue by anchoring filaments. 4. No pump for lymph. 5. Lymph is kept moving by constriction of vessels, skeletal muscle pump, respiratory pump. 6. At intervals along vessels lymph flows into lymph nodes. 7. Lymphatic vessels unite to form lymph trunks. Lymph trunks. 1. Formed by lymphatic vessels uniting. 2. Large tubes. 3. Empty their lymph into lymphatic ducts. Lymphatic ducts. Lymph empties into two conducting ducts, the thoracic duct, left lymphatic duct, the right lymphatic duct. Lymph from these ducts enters the bloodstream via the left subclavian vein and the right subclavian vein. Thoracic duct. Left lymphatic duct. Times about 15 to 18 inches, 38 to 45 cm, in length. Times main collecting duct of lymphatic system. Times receives lymph from lower body and upper left quadrant. Times empties into the left subclavian vein. Right lymphatic duct. Times about 0.5 inches, 1.5 centimeters, in length. Times receives lymph from upper right quadrant. Times empties into the right subclavian vein. Lymph nodes. Oval or bean-shaped, masses of lymphatic tissue, aid in defense and white blood cell formation, located along length of lymphatic vessels, scattered throughout the body usually in clusters, covered by a capsule, contain capsular extensions called trabeculae, form partitions within node, internal to capsule are reticular fibers and fibroblasts, form framework of a lymph node. Two main regions of a lymph node, cortex, medulla. Cortex, outer region directly beneath the capsule, contains densely packed lymphocytes arranged in masses called follicles. Outer rim of follicle contains T cells, macrophages, and auricular dendritic cells, aid in T cell activation. Medulla, inner region, lymphocytes are arranged in strands called medullary cords, contain macrophages and plasma cells. Biological filtration. 1. As lymph passes through a node, bacteria and other foreign materials are trapped by reticular fibers within the node. Bacteria are then phagocytized by macrophages. 2. Plasma cells produce antibodies to antigens in the YMPH. 3. Antibodies, lymphocytes, and monocytes are eventually returned to the blood via subclavian veins. Major lymph nodes. 1. Cervical. 2. Axillary. 3. Inguinal. 4. Mesenteric. 1. Cervical, located in neck area, filter lymph from head and neck. 2. Axillary, located in armpits, filter lymph from hand, arm, breast. 3. Inguinal, located in groin area, filter lymph from lower extremities and external genital organs. 4. Mesenteric, located in abdominal peritoneum, aid in infection control after abdominal surgery, filter lymph from abdominal cavity. Tonsils. Aggregations of large lymphatic nodules, embedded in mucous membrane, located beneath epithelium of pharynx and oral cavities, protect nasal and oral cavities. 3 types: nasopharyngeal tonsils, palatine tonsils, lingual tonsils. Nasopharyngeal tonsils, commonly called adenoids, located behind nose, on roof of posterior wall of pharynx, posterior opening of nasal cavity. Palatine tonsils, usually referred to as the tonsils, location, back of mouth, lateral walls of pharynx, most commonly removed tonsillectomy. Lingual tonsils, base of tongue, first line of defense from exterior. Spleen. Spleen, largest lymphatic organ, located in upper left abdominal quadrant, between fundus of stomach and diaphragm, 5 to 6 inches long, 2 to 3 inches wide, resembles a large lymph node, filters blood. Structure of spleen: capsule, covering of dense connective tissue, hilum, depression on medial surface, nerves and arteries enter spleen, veins and lymphatic vessel exit. Structure of spleen: cont, trabeculae, extensions of capsule, form partitions within the spleen, pulp, tissue inside, divided into red and white. White pulp consists of lymphatic tissue. Functions of spleen: phagocytosis of bacteria and worn out or damaged red blood cells and platelets. stores and releases blood in times of demand, e.g., hemorrhage. Functions in immunity as a site of B-cell proliferation into plasma cells. Does not filter lymph because it has no afferent lymphatic vessels or lymph sinuses. Thymus gland. Two-lobed organ, located in upper part of chest along trachea, inferior to thyroid gland, posterior to sternum, largest and most active during prenatal period and infancy. After puberty it decreases in size, composed of lymphatic tissue, subdivided into lobules. Immature T cells originating in the bone marrow migrate to thymus via blood. In thymus, cells develop into mature T cells for release into circulation. Thymic hormones aid in maturation of T cells. Mature T cells travel to lymph nodes, spleen, and diffuse lymphatic tissues where they reside, responsible for cell-mediated immune responses. Bone marrow. Complex tissue which is the site of hematopoiesis and fat deposition. Hematopoietic cells generated in bone marrow move through walls of blood vessel and enter bloodstream, which carries them out of the marrow and distributes these cells to the rest of the body. Immature B cells arise from lymphoid progenitor cells, proliferate and differentiate in bone marrow. Bone marrow B cells are source of 90% Ig and Ig in the plasma. B cell maturation occurs in bursa of Fabricius, a lymphoid organ associated with the gut, is the site of B cell maturation. Malt galt bolt calt mucosa-associated lymphoid tissue. Malt section of lung showing a collection of lymphocytes in the connective tissue of the bronchiolar mucosa, an example of mucosa-associated lymphoid tissue, malt. Pararosanilin toluidine blue, PT, stain. Low magnification. Non-capsulated lymphoid nodules in mucosa or submucosa of GI tract, respiratory tract, urinary tract. Gut-associated lymphoid tissue, GULT, Peyer's patches, B cells surround by T cells and APCs. Bronchus-associated lymphoid tissue, BOLT, similar to Peyer's patches. Calcutaneous-associated lymphoid tissue. Skin is the largest organ of the body and plays an important role in defense mechanism as anatomical. Barrier epidermal layer of cells composed of specialized keratinocytes, which produce cytokines that induce local inflammatory reaction. Thank you.